Hi everyone, my name is Jason Hakin. I'm here from the safeguarding team. I'm here with our named nurse for domestic abuse and violence, that's Yvonne Hartwell. Yvonne, we're looking today at how the pandemic has affected our work in this area. Can you give us an update locally and nationally about what you're seeing at the moment?
Yeah, nationally we have seen an increase in calls to the domestic abuse helpline. And unfortunately, there's also been a spike in domestic abuse homicides during the lockdown period. Birmingham, however, didn't experience an initial increase in calls to the police during the first stages of lockdown as expected. The calls actually increased when they extended the lockdown. The reason being for this, what agencies feel, is that women were actually managing their home situations and the risks in the initial part of lockdown, and when it was extended, that they felt that they could cope no longer with that, and that's why we've seen these surging calls. We've also now got a backlog in cases waiting to be heard at MARAC, which is the High Risk Domestic Abuse Forum, and we're now listing into the end of July.
Right, and what do we know about how victims have been affected?
Well, we know that when the country went into lockdown, that this would have a real impact on the lives of women and children who were experiencing domestic abuse. COVID-19 itself doesn't cause domestic abuse, but what we do know is that it does have a huge impact on the resilience of relationships and families, which then create this high prevalence of abuse happening.
And what can we do across the trust?
Well, I think it's important to remember that it's business as usual for safeguarding. Nothing has changed into our safeguarding responsibilities. What has changed is our trust way of engaging our service users. A lot of community teams now are using video calls or telephone calls to our service users, which has created a gap because there's less face-to-face contact. What we would like our practitioners to remember and to consider when they are having those telephone and video consultations is it safe for your service user to talk? Who's in the room? Who's in the home? Who can overhear your conversation? If it is safe to talk, then you could consider using a DASH risk assessment if you are ensured that there is no one else within the home. And that DASH risk assessment is a way of exploring what the current risk is. It would be better to do this face to face, however, we know under the current restrictions that may not be possible at all times. Listen and validate your service user as well. So when someone is disclosing domestic abuse, it's really important for them to feel that they're being believed. And be prepared to have this conversation again and again.
And it's more important than ever to think family of them.
It is. So we need to understand about our service users' families' composition. Who is in their family? Are there children? Are there extended family members living with your service user? I think it's also important to understand who supports your service user from a professional perspective. So do they have a social worker? Do they have a support worker or health visitors from the universal services? It's important to link in with these partner agencies as part of our partnership working, because that will help to mitigate the risk and to share important information. We know that with Birmingham Children's Services, there's the majority of referrals that go through CAS are domestic abuse related, and a high proportion of those domestic abuse cases also have parents where mental health are involved with them as well. So it's important for us to understand the offer from partner agencies, because they will also have their own limitations of how they're currently working with people at the moment and families. So please don't assume because you've got a social worker involved or a health visitor involved that those families are being seen on a regular basis.
Okay, and is there a message for colleagues working with perpetrators?
I think it's important not to manage these cases on your own. So please take any cases where you've identified that your service user is perpetrating abuse towards their family, take that to MDT. This will help you explore ways in which people can engage their family So it may be that we need to offer their family or their partner a carer's assessment or an appointment or an opportunity to just explore what it's like for them at home and what it's like for their children at home. If you're not in a position to do that, I think it's important then to go back to your partner agencies if you are aware of who's working with that family, again to explore if someone is in a position that they can do that with you. The other important factor is to make sure that we share relevant and proportionate risk information with the key partners and key agencies that are involved with your service user.
And in summary then?
To summarise, I think the main points for me would be, please make sure we listen to our service users and validate their experiences. Be empathetic and try to be as non-judgmental as possible. Make sure that we're thinking family and recording information appropriately on Rio by using the children and siblings page. Be prepared, as I said before, to have conversations about domestic abuse time and time again. Remember that our service users are the experts in their own experiences, so they will be already putting safeguarding in place for themselves, and it's important to listen to what they need in order to help them feel safe.
Okay, thank you. That's brought us to the end of this briefing. Just to let colleagues know that this briefing will be available on Connect, and it goes alongside a 7-minute briefing that we've produced in document form for colleagues to use with their teams, so that they can have some discussions about their response to domestic abuse during the pandemic. The message is, as ever, safeguarding is business as usual. Colleagues, please do contact the safeguarding team if you need to. And thanks very much for your time this morning, Yvonne.
Thanks, Jason.
Bye-bye.
Bye.
Bye.